My name is Travis Wamsley. I'm an assistant professor of nursing here at Fairmont State University, and along with Professor LeCanty, we are presenting Total Wellness Tuesdays. This is sexual health and prevention. So why is it important? Why do we want to talk about sexual health? Well, according to the CDC, which is the Centers for Disease Control, young people account for a pretty substantial proportion of new diagnosed cases of STIs. And STI stands for sexually transmitted infections. It used to commonly be called STDs or sexually transmitted diseases, and you often hear those used interchangeably. So here, if we look at this little chart, this actually shows that the majority of these new cases are actually individuals between the ages of 15 and 24. And then also ages 25 and up. So up to 70% of new cases of gonorrhea, 63% and 63% of cases of chlamydia are all going to be in that 15 to 24-year age range, which is our majority of our college students fall within that. Now, we do have some outliers. Obviously, HIV, syphilis, STIs like that are typically still going to be older adults. But we're commonly seeing, again, the chlamydia, gonorrhea, and HPV, especially in younger adults now. So here's some facts from the CDC. So there are approximately 1.8 million cases of chlamydia. That's about a 19% increase since the last time they did a study in 2014, which is huge. That's a huge number of cases. There are about 583,000 cases of new cases of chlamydia, which is a 63% increase, and about 115 new cases of syphilis. Sexually transmitted infections are defined as infections that are spread primarily through sexual contact. They're the most common infectious disease in the U.S., which is estimated to be about 20 million new cases every year. As I said, 15 to 24-year-olds are going to account for about 50% of these new STIs in the United States. And infections can really potentially be life-threatening and can have immediate and long-term health consequences. So if left untreated, they're actually going to increase your risk of developing HIV, long-term pelvic or abdominal pain, and they can actually result in infertility or an inability to get pregnant. Here's another little, again, estimation. Again, just a different chart showing the same things we talked about, the number of different cases that and in the percentage of 15 to 24-year-olds and then 25 and above. Here's some symptoms. And now the thing is, remember that you're not going to see these symptoms in everybody. So you may or may not have symptoms. If you've been exposed to an STD or an STI, it's definitely best to seek treatment by a medical professional just to make sure. So with chlamydia and gonorrhea, we typically see discharge. So this will be discharge from our genitals, but you may have no symptoms at all of these, and you walk around without symptoms and could possibly spread that to someone else. Syphilis, you're going to get usually a painless skin lesion. Trichomonas usually is discharge. HSV, you're going to usually have painful skin lesions, and HPV, usually is painless skin lesions. Here's another chart that kind of breaks that all down for you. So again, here's very common STIs. So we have bacterial vaginosis, which is usually called BV. It's often associated with not using condoms during sex, having new or multiple sexual partners. This one usually results in an off-white vaginal discharge, and it also increases your chance of getting other STIs. It is treatable with antibiotics, but you have to get those antibiotics from a healthcare professional. Chlamydia, again, one of the most common STIs, especially of people under 25. Most people who have chlamydia do not have symptoms, so it's very easy to spread it to someone else. It's also treatable with antibiotics. We typically have gonorrhea lumped in with chlamydia because a lot of times people have both. This is what used to be called CLAP. Men may or may not have burning when they pee. They might have discharge. Women usually don't have any symptoms as well. Of course, we have genital warts. That's caused from HPV. Those cause like small flesh-colored bumps. These are treatable with prescriptions, but it never goes away. It always stays in your system. Same thing with HSV, herpes simplex virus. This is what causes commonly called cold sores on your mouth. Same thing, you can treat the symptoms, but this is an STI that you're going to have for life. HIV, of course, is a very infectious virus spread by blood or body fluids. We have HPV. This is, again, what typically causes genital warts. It's also responsible for a lot of cervical cancer in patients, in young adults. Pelvic inflammatory disease, which is usually caused by untreated gonorrhea or chlamydia, syphilis, and trichomonas. So most of these are treatable with antibiotics, but some of them aren't, and that's why we have to take all of them seriously. So definitely we want to practice prevention, but if you do believe you've been exposed to an STI, you want to seek health care as soon as possible to prevent the spread to others. So when we talk about prevention, we talk about the right way to use a male condom. This is going to be your most commonly used form of prevention. So you use a condom every time you have sex. You do not put a condom on, do put a condom on before you have sex. You don't put it on the middle. Do check the package and check the expiration date. Make sure it doesn't have any tears or defects. Keep it in a cool, dry place. So you don't want to store this in your wallet or your glove compartment. Do you use latex or polyurethane condoms? And do you use silicone or water-based lubricants to prevent breakage? Now, here's a little guide from the CDC on how to put on a condom. So again, you want to make sure that you put them on every time before you have intercourse. You don't want to store them in a wallet because the heat and friction can cause it to break down. You don't want to use oil-based products like baby oil, lotion, petroleum jelly. You do not want to use more than one condom at a time, and you don't want to reuse your condom. So how to prevent it? So practice abstinence. So obviously the most effective way to prevent STDs is to not have any sex. That means no vaginal, oral, or anal sex. Have fewer partners. Talk with your partner, so have open conversations about them. Use condoms, use them correctly every time to help prevent STIs. Get vaccinated, so especially HPV vaccinations. And get tested. So get tested regularly if you are sexually active, but also get tested if you think you've been exposed. The other part of sexual health is taking care of ourselves and doing monthly exams. So for men, we're going to do a monthly testicular exam. So this is best done after a warm shower or bath. And you want to examine each testicle with both hands. You want to place your middle fingers on the testicle with thumbs placed on top. Firm but gently roll the testicle between your thumbs and fingers to feel for any irregularities. And of course, if you notice any changes or have any irregularities, talk to your healthcare provider immediately. So for women, we talk about doing a self-breast exam to check for breast cancer. So it's usually done once a month. You want to examine the entire breast and armpit area. Use the pads of your fingers. There's several different methods you can do, but what you're looking for, again, is feeling any kind of lumps or masses. Become familiar with your body, and any changes, you would also want to report those to your healthcare provider. Here's some resources for you guys: the American Cancer Society, Centers for Disease Control and Prevention. You can also contact Fairmont State University Student Health Services. They are on the 3rd floor of the Falcon Center, Testicular Cancer Society, and the World Health Organization. So this has been a brief little overview of STIs and prevention. Again, remember, the best way to prevent STIs is to abstinence. After that is to have protected sexual intercourse every time and reduce your number of partners. Any questions, if you have any other curiosities, definitely view these websites. They have lots of great, reliable information. All right, thank you so much, and thank you for watching Total Wellness Tuesdays. Again, my name is Travis Wamsley, assistant professor here at Fairmont State University.